Dr. Madi Spainhower. Dr. Spainhower grew up, actually was my neighbor, and then moved down the street, not too far, and her mother was here and sister. They're an awesome family, and I've known her since she was really little. Maddie went on to get her bachelor's degree at Weber State University, and after her bachelor's degree, she went to St. Augustine University. There she got her PhD in physical therapy, primarily working in pelvic floor physical therapy. And this is really, really important because when I was in my professional career, the end stages of folks that had really difficulty with urinary incontinence or bowel incontinence, the surgeons we'd work with, they'd plant about the size of a silver dollar in a patient right here, and then put electrodes down in to hit a nerve that would close the neck of the bladder. And these patients, both men and women, could not walk 3 feet without urinating at all. So many of them had to have multiple changes of clothes until they got this device. So if we look backwards and go and look, the pelvic floor is so important. It's the foundation for everything. And without further ado, we're going to learn a lot from Maddie today. So I'm going to turn the time over to you right now.
Thank you.
Okay.
I've never been mic'd up before, so this is making me a little nervous.
You have to breathe into it.
Yeah.
Let's
go.
Okay.
Cool. Thanks, guys. Thanks for having me. It's fun to be here. I don't live too far anymore, but I am here to talk all things pelvic floor, health and wellness-wise.
Thank you. Our YouTube channel will be grateful they can see you and not just hear you.
I might pivot this onto the ground. I don't know. My background, Hugh gave me a great introduction. So I grew up here, got my doctorate in physical therapy from the University of St. Augustine. I've been practicing a little over 5 years, and primarily in pelvic floor. I started out in Logan, worked there for a little over 3 years, built their pelvic floor program there, fell in love with it, and it's kind of been my passion ever since. And then I've been working with reborn since September, and they're phenomenal. It's kind of like the dream gig. I get to spend every visit one-on-one, a full hour with everyone that comes through the door. So it's kind of getting to deep dive into the art of physical therapy and pelvic floor, and treating each person as an individual rather than like, I don't know if any of you had experience with physical therapy clinics, but it's kind of like you go in, you get like 5 minutes with the PT, and then you're passed off to the aide for exercises and such. So this is the dream job, and I get to do the dream keystone element. And I'm board certified in pelvic rehab, so that means I saw a lot of people with pelvic floor dysfunction, and I sat for a lot of classes, and then I paid to sit for an exam, and I passed that exam and got more letters behind my name. And then I'm also dry needling certified. Yeah, thank you. This is awesome. VIP. You can just hit the arrow.
There we go.
Okay, so why pelvic floor matters. I feel like over the last 5 years that I've been practicing, a lot of us kind of suffer in silence, or our concerns are kind of disregarded as normal, or we get just drink some wine and relax. This is part of aging. You've had a bunch of babies, you're pregnant. All this is like normal, quote unquote. So kind of being a part of that, like breaking the normal and breaking that stigma, because it's not normal. It's common, yes, and I'm sure lots of us experience that. The reason why I went to pelvic floor was my own experience. We won't get into those details, but I want to change lives like I was able to change my own through pelvic floor rehab. I want to also give like a big round of applause for Hugh and the team here that sees a need for talking about this stuff and bringing it up. And the fact that he reached out to me, he's like, I want to educate the community on this. Like, I've got people that have kind of shared a few things with me, that core exercise is helping them see an improvement in their symptoms. And I want our instructors to know how to cue their cue our clients and our gym members better, so that we're supporting their pelvic floor health, which I think is amazing. I'm gonna kind of review this quick little screening protocol. This one, you guys can participate if you want, or just kind of keep track of your own number in your head. But you're just gonna kind of hold a finger up for each one that applies to you, or you can do that in your mind. So this screening protocol is to screen out pelvic floor dysfunction. And I'm just gonna go through the questions. The first one is sometimes have pelvic pain. So that can be in the genitals, the perineum, the pubic or bladder area, pain with urination that exceeds a 3 on a 1 to 10 pain scale, and 10 is the worst imaginable. And then the next question is, I can remember falling onto my tailbone, low back, or butt, even into childhood. And the next one is, I sometimes experience one or more of the following urinary symptoms: accidental loss of urine, feeling unable to completely empty my bladder, having to void or urinate with a few minutes to a previous void, so you get up and you have to pee again. Pain or burning with urination, difficulty starting or frequent stopping and starting at urine stream, so not that nice and good stream. It's poor emptying. The next question, so that one is like all those underneath. If you answered yes to any of those, then that's another finger. I often or occasionally have to get up to urinate 2 or more times at night. The next question is, I sometimes have a feeling of increased pelvic pressure or the sensation of my pelvic organs slipping down or falling out. The next question is, I have a history of pain in my low back, hip, groin, or tailbone, or have had sciatica. I sometimes experience one or more of the following bowel symptoms. So this is kind of a lump. If you answer yes to any of them, it counts as another finger. So loss of bowel control, feeling unable to completely empty my bowels, straining or pain with bowel movement, and difficulty initiating a bowel movement. And then next question is, I sometimes experience pain or discomfort with sexual activity or intercourse. And then next question is, sexual activity increases one or more of my other symptoms. And then last one is, prolonged sitting increases my symptoms. So if you answered yes to 3 or more, so if you have 3 fingers up, pelvic floor dysfunction is likely, and you probably benefit from pelvic floor therapy. Does anyone want to share how many of you heard people talk about pelvic floor issues? Do people talk about it? Is it still kind of taboo and hush? Does anybody raise a hand if they've had people chat about it with them, chat about it with other people?
It's kind of embarrassing.
Yeah. Because you feel like it's not normal. Yeah.
We probably all heard the word kegels.
Yeah, yep, right? It's like you go in and you express your concerns. It's like, well, are you doing your kegels? Okay, that was not helpful. Thank you for sharing. I'll go next one. Thank you. Oh.
Where's the arrow?
It's okay. There we go.
Yeah, I did that.
Okay, so just some numbers. So 1 in 8 men will experience pelvic health symptoms during their life. 1 in 3 women will experience some form of pelvic health dysfunction. So you're probably sitting next to someone that has similar symptoms to you. 30 to 50% of women experience sexual dysfunction, and 50% of men over 50 have sexual function issues. And 80% of people with low back pain also have pelvic floor dysfunction. So it is very, very common, and it's okay to talk about. And it probably opens up a lot of communication and conversation that we all need to have. Okay, I don't know how much you guys want to deep dive into anatomy, but this is just like a little intro as far as pelvic floor goes. There's essentially 2 different layers, superficial and deep. Superficial is kind of really close to the top of the skin, and deep is deeper into the pelvic bowl. For these in. So most of us are female here, so leave this one. This first layer is responsible for closing when we don't want to go, opening when we do, and also sexual function. And then this next layer, the deep pelvic floor, is all about support, keeping us upright. If we didn't have this function, we'd fall over. That's why it's kind of our keystone. And it creates support for our organs, so that kind of organ slipping out type sensation. So I won't go into all the nitty gritty with names and such, but if you'd like to chat with me after, feel free. Thank you. This is just comparing like male and female deep pelvic floor anatomy is identical. For like one muscle deeper in the pelvic floor, but it's all essentially doing the same function with balance and support. Perfect. Okay, so when it comes to pelvic floor, we have to consider everything that supports the pelvis along with the pelvic floor. We can't just get a zoned in view of this. We have to take a bigger lens and look at the whole person. So abdominals and how they connect into the pelvis, the low back and how it connects to the pelvis and the sacrum, SI joint areas, the hip rotators and how they play a role. And we'll go over some of this here in a later slide where we're more interactive and seeing how just a simple posture adjustment can help. Good. Okay, and then I kind of touched on this a little bit, but functions of the pelvic floor. It's not just for having babies. It's for urinary and bowel function, stop when you don't want to go, let it go when you do, recognizing urge, support, keeping us upright, support for organs, sexual function, pregnancy and childbirth, and pressure management and breathing. The pop can analogy, so cute. Okay. So the way our body stabilizes our spine is through this pop can analogy, diaphragm and pelvic floor. So diaphragm is the top of the can, pelvic floor is the bottom of the can, and that creates a nice solid core canister so that our spine is nice and stabilized. And if there is dysfunction in that, you can imagine how this will become less stable and more chronic back pain, injury risk, things like that. So we want to look at the whole abdomen. So really quick, if everyone wants to stand up with me. Okay, so I'll give you one quick cue, so stand up nice and tall. Good. Did anyone feel them go like this? No. So nice and tall posture. Think more pelvis directly underneath diaphragm or diaphragm directly over pelvis, whichever helps you the most. And just a little bit taller. If we're going into more like a drastic untuck, nice and tall, army posture, this is all shortened through here. And our pelvic floor and our glutes aren't working optimally. It's a nice, just tall posture, simple, it doesn't have to be exaggerated. And then you can also do the opposite of tucking. And pay attention to like what you feel happen in pelvic floor when you do a tuck. Do you feel how it like adds a little bit more pressure down there? A little pooching of the belly maybe. So posture can be a really simple day-to-day. And we'll go over some more here in a little bit. But that's just the canister, that's the pop can analogy, and it's important to have both the diaphragm and the pelvic floor working together in an optimal posture so we can have nice stability of our pelvis and we can combat against things like pain here, and even pain into the pelvis and pubic bone. Thank you. Okay, so signs of dysfunction. This is not an all-inclusive list, but this is just some that might indicate pelvic floor dysfunction. So, like sexual dysfunction. So, ED, there's a lot of reasons why we can have ED. So keep that in mind. It's not just pelvic floor function. So you have to kind of mark out all the other possibilities. Pelvic pain, that's a very broad term. It can be here, it can be deep, it can be in the tailbone, it can be in the SI area, it can be in the low back, it can be in the hip, like any pain in this region. And then we talked about incontinence, even if it's like, you see these cute little videos all the time on Instagram where people starting to laugh really hard and they've got pee down their pant, like their pant leg. But even if it's just a dribble or two, That's not ideal. It's not normal, and it can show a sign of dysfunction. So we're able to like not leak when we're running, or not leak when we're sneezing, or coughing, or laughing. And it can be embarrassing, but we all laugh it off. But don't let it kind of just keep at the wayside when we address it. Constipation as well. So there is a difference between like constipation because your bowel is really hard and your stool is really hard and firm, and that's more like nutritional balance. And then there's also the constipation coming from dysfunction, defecation. So it's like your pelvic floor won't let the stool come out. So signs that it might be more functional musculoskeletal constipation is it almost comes out like a squeegee. I know that sounds kind of gross. But really thin, soft stool, but it's just really, really hard to get out, and it takes a long time to empty. That can be related to pelvic floor muscle strain. There is a muscle that wraps around the rectum, and its job is to keep stool in when we don't want it to, but then it's also meant to lengthen so we can empty when we want to. And then pain. Within intercourse, we're going to talk about some of those dysfunctions. Pain during, pain after, pain with orgasm, all of the things encompassing sex. And then urinary frequency and urgency. So that one's always really frustrating. You go pee and then you go for like a 30-minute car drive and you have to hustle to the bathroom at the store. That is not common, and it can be triggers from multiple things, and it can also be pelvic floor muscle, but sometimes it's just the external cues. We get to a store and all of a sudden we have to pee just because we arrived at the store, or we get home and pull into the garage and it's like, it hits us like, I gotta get in that house right now, I'm gonna pee right here on the garage floor. And it's not an age thing. I'll tell you myself, I'll admit it, I experienced this after I had my son, and he was 2 years old, so I was 2 years postpartum, and I had to jump in bushes in public places all the time. So it's very frustrating, and it's not age-based. Pain can be a liar. This thing is kind of fun. It says pain can be a liar. So overactive tense pelvic floor muscles can feel like back pain, constipation, strong bladder urges, back SI tailbone pain, and pain during intimacy. Okay, so what could be causing all these problems? We have to take the whole person you can go. So I'm sure you've seen it in social media, pelvic floor tension, pelvic floor weakness. Just because a muscle is tense doesn't mean it's strong though. And then pelvic floor coordination, just muscle awareness. What is a Kegel to you? Do you have the balance of hip muscles versus pelvic floor muscles? And then muscular tension, decreased joint mobility, really tight hips. That's going to put a strain on our pelvic floor. Our bodies are really, really cool about Our bodies are really, really cool about compensating, but these compensations can kind of stack and stack and stack, and your body will kind of knock at you that something's going on, and then all of a sudden it's just kind of pounding on the door, and then you kind of have to peel back those layers to address it. Toileting habits, squatty potty is a thing, and it works. It helps that muscle that holds around the rectum to lengthen. So it doesn't have to be a fancy squatty potty, but just something right underneath your toilet that you can tuck in. I've had patients use books and baskets and things that they just have around their home, but it improves that angle and allows that stool to come out better. And then there are things that we do as kids, maybe even as adults, where we sit down and we hurry to pee, so we kind of push the pee out as fast as we can so we can get on to playing, or we try to like quiet our pee so nobody will hear us and stand next to us. So those toileting habits can create these issues. And then posture. And then of course you want to take the whole biopsychosocial component as well when it comes to pain. Even if we address all the musculoskeletal pieces, we have to also address the nervous system, stress responses, because they all play together. So stress management. And then there are patterns like that on the end, last slide at the very bottom that was cut off. You're okay. I said the reason why you have pelvic floor tension might not be why you're, or the reason why you have pelvic floor dysfunction may not be the same reason as your neighbors. But there are very specific patterns. So go ahead and stand up again. And we're gonna do a single leg balance. Just lifting up one leg. And then tune into your pelvis. Did you feel it drop on the other side? Do you have a hard time holding that? Do you have any pain? And then you can go ahead and swap to the other side, balance. And see if it differs from side to side. If you have that hip drop, that can tell us one thing is a weakness in a pelvic stabilizer. And if we get that weakness through that glute med, our pelvic floor has to compensate for that. And then again, it's just that stacking. And then we already went over the diaphragm, pelvic floor posture. And then we'll do a little bit more on this. Thank you. Okay, we kind of hit on this earlier when we said we've all been told to do your Kegels or Kegels. So to Kegel or not to Kegel? Any thoughts on that? You guys can sit down. do some of you feel like, I don't know exactly what a Kegel is, what it should feel like, what it should Thank you. So a Kegel, it was named after some old doctor guy way back when. But it's basically contracting your pelvic floor muscles up and in. So the reason why we're bringing this up is Kegels shouldn't be blindly given to everybody that's suffering from some pelvic floor issue. So if you go into your doc, it's like, I swear something is coming out. I feel like a bulge, I feel tissue, I have like a tampon sort of feeling, and I don't have a tampon in. And they just like, well, do your Kegels. Take that with a grain of salt because it's not just about pelvic floor strength if it's coming from your hip or it's coming from your feet. So it shouldn't be just do your Kegels if you're leaking, or do your Kegels if you're suffering from urgency or suffering from tooting in classes, can't hold back your toots in an elevator. We want to focus on the entire body. Yeah, please, love it.
How do you know you're doing great? Demo.
Yeah.
Demo.
I love it.
No, that's what I'm asking.
Well, the best way is honestly self-examination. So you can insert a finger and see if you can close evenly around that finger and if it draws up and in. If you feel like almost it pushes your finger out, or there's one side that kicks on a little bit better than the other side. The pelvic floor muscles, when you contract, they're all going to contract together. It's a muscle that you can't contract this side and then that side. But that doesn't mean it's going to be a symmetrical contraction. But like simply put, if you can stop your pee when you're going to pee, if you sit down on the potty, I know there's a lot of fear around this, like we're not supposed to do that because it can cause UTIs. It's actually not true. There's no research that supports that. There's actually research that does the opposite. But somewhere along the line, one doctor said it, and then we all just like clung on to it. But you can do the stop flow test. That one, you sit on the toilet, you wait till your pee is a nice, good, strong, at the strongest point of its stream, and then you close it and try to stop it 100% and hold it for 2 seconds and let it all go. That's a really good baseline. That's more for the top muscles. And then we have the deep pelvic floor, deep core. If you can feel your core engage when you're doing that Kegel or that pelvic floor lift, you're probably doing it right. If you feel like your belly almost pinches out or you're almost bearing down, you're probably doing the opposite. But pelvic floor PTs can tell you too. You can go to the next one. Okay, integrating pelvic floor health into daily life. So we already kind of talked about posture. But you can also strengthen through functional movements that you're learning here, squats, lunges, bridges. But a big part is just having body awareness and slowing down through your reps sometimes and seeing like, where do I feel this working? Is it like all my hamstrings? Is it all my quads? Do I feel a little bit in my glutes? And just pay attention and try to test some things too. If you're in a squat, let's do it. Everybody stand up.
Show her good. See what we're doing.
I have to go pee now. We're gonna sit down as slow as you can. Like if you can go as like slow as snail, and see what you feel kicking on. Is it my booty? Is it my knees? Is it my quads? Is it a little bit of everything? Is this hurting? And then you can sit all the way down into your chair. Good. Any? Good, I love it. Any thoughts? Did you feel the glutes? Did you feel your quads? Did you feel your knees? Yeah. Okay. So now we're going to try to make it all be glutes. So before you stand up, I want you to squeeze your butt. Just engage those glutes. And then keep that squeeze as you slowly come out of your chair. Like keep that slow. Keep that squeeze. Good. And then you can come all the way to the top. Squeeze your glutes again. Send your hips back. Keep that squeeze in the booty and go as slow as you can. So this is that like body connection. Can you feel it? Is it a little bit more in the booty? Yeah, good. So it's just about cueing your body and paying attention to those muscles a little bit more. Okay, and this is kind of a posture check. This is kind of my checklist when I evaluate a patient, and how everything is connected. It's so cool. So the jaw, just sitting there, pay attention. What are you doing with your jaw? Are you clenching? Where's your tongue at in your mouth? And then I want you to push your tongue. So take a side note of what you're doing right now with your jaw and your tongue. And now I want you, actually I'm gonna make you guys stand up again, I'm sorry. I want you to push your tongue as hard as you can into the front of your mouth, into your teeth. As hard as you can. What happened in the pelvic floor? Did you notice anything? And then you can relax it back. Did you feel it tense? Yeah. So the jaw, the larynx, this area is actually connected fascially to the pelvic floor. So when we're, side note, it's really cool, but when we're a fetus and we're growing, those two pieces are connected and then we expand and get a spine. So fascially, it's connected. So then go ahead and take your tongue gently to the top roof of your mouth and slide it back just a little bit. It's nothing like you're shoving your tongue back there. Just gentle position. You almost feel like a better alignment with the neck. You feel a little less tension through here. And then do that a couple times and compare. Shoving that tongue into your teeth, really clenching your jaw. What happens everywhere else, right? And then going down, a fun little thing about pelvic floor tension and jaw tension, TMJ stuff, right? All this pain through here. Humming can be really helpful to release tension here and tension here. So hum while you're doing the dishes, hum while you're driving the car, and it will help relax and release the pelvic floor tension. Upper ab gripping, so don't do anything but just feel your abs. Are you clenching? Are you squeezing? Do you seem to like hold a lot of tension here in the upper abs?
I can't find it.
And then you're gonna try to breathe and just like let that go. So day to day, you can pause and check in. You're like, what am I doing? And you can. I am a clencher through here. This is where I hold all my tension. So tune in, palpate, touch this area without giving yourself any warning, and see, oh, yep, I'm squeezing. I can almost see the fold in my belly from me holding the tension through here. And perfect. So that, if you can imagine this clenching here, so go ahead and just squeeze your upper abs. Do you feel like the pushing of the lower belly and then pushing into the pelvic floor? So it's, again, this like stacking on domino effect of little simple things that we do that we don't even know we're doing, but it can create problems down the line. Yeah.
You're saying you want us to not be tight when we're doing this check-ins.
Yeah.
You want us to
Yep.
relax, not have
Right. Yes.
super uptight. Okay.
Yep. So, and have grace with yourself. Like, don't feel like, ah, crap, I'm holding tight here again. It's just body awareness. We're gonna move through life. We're gonna have stress. We're gonna hold tension. But it's just those moments that we can pause in regularly. I use my sink, because I'm at my sink at least 10 times a day. Dishes, prepping food, washing hands, helping brush teeth with my kids, brushing my own teeth. So that moment, I just pause and I just check in with everything. I feel my belly. I do a couple deep breaths. I check in with my feet and my pelvic floor. And then if you like start running around the house and immediately start pulling tension here, that's normal. It's just being able to combat against chronic holding and tension. Good question. Okay, and then diaphragmatic breathing, this kind of goes hand in hand with this upper ab gripping. So the diaphragm, that sits right underneath these ribs here, and it's that top of the core canister. Being able to breathe in through the diaphragm, so just taking a nice deep breath go for it, see where you feel it. I like doing this the best in seated or laying down just because it's a little more comfortable. But seeing if you can get that nice full 360 breathing. A really fun way to check in is getting like a TheraBand, a little elastic exercise band, wrapping it around this lower part of your back and ribs, and then trying to breathe and expanding it. It's a really good cue because it's kind of hard. It's like, I don't know, am I doing this right? But having that cue band for your hands and breathing.
Oh, you asked. Here it comes.
Oh,
We want to see, right?
yeah, I love it. So this is what you could use. Wrapping it around. I'd probably tie your butt, and then just breathing into that band. And out. So it's not like exaggerated belly breathing. It's the whole 360 breathing. It's like an umbrella's in there. You're opening that umbrella up as you breathe in, and then you're closing it down as you exhale out. Okay, and then we already went over the diaphragm posture, hip strength, and connection to the pelvic floor. So real quick, we're gonna do a split stance, just like one foot in front of the other. Nice, easy, comfortable position. It doesn't have to be directly in front, just kind of like you take a little step. And then you're gonna stick your butt out. And then you can keep your feet closer together too. Like it doesn't have to be, it's very chill. And then you're gonna rotate your back pelvis towards your front pelvis. And then back out. And just see what you feel working, if anything. You have the range of motion. And then any comments on what you feel working? Okay, all right.
Is that
Part of it. So I want you to now squeeze your booty again and think about this, these hip rotators. And you're gonna rotate and lengthen and let them go really, really slow and long. You're squeezing them into that lengthened face. And then you're gonna squeeze them as you come back to neutral. Feel a little bit on your booty. So those hip rotators, these guys, if we've got weakness or tension through them, then our pelvic floor will compensate for that. Because they almost like pull the pelvis like this, and then you can imagine what that's going to do to the pelvic floor. Glutes with posture during pregnancy, that's a really common one because of our center of gravity. I've been really bad at this camera, I'm so sorry. Center of gravity, we adjust, and that's why we get the mom butt, right? It just disappears because it's shortened. It's shortened for a long time, and then we have to re-engage that. But then, because that's shortened, the pelvic floor has to make up for it. It's all a balancing act. If one side of the glutes is really tight, but the hip flexors on this side are really tight, you can imagine how that's going to create like a torsion in the pelvis. So then you get things like SI joint pain right here, or pubic bone pain. And then our pelvic floor has to make up for that. So that's, again, another example of how muscle balance is just awesome. Okay, and then, glute clenching. So as you guys are standing there, does anybody feel like they're squeezing their butt? Yeah, shake it out. That's another good body check aside from here. It's like tuning into your glutes. Am I squeezing the back of my pelvic floor and just crushing my tailbone? Whew, okay, I'm gonna relax that and let it go down and breathe into that and let my booty go. Let my tailbone go. Okay, feet and arches. Okay, so this one's kind of fun. It should be pretty good in shoes. If you want to do it later without shoes, it might be easier felt. So feet can perpetuate hips up and vice versa. But so you're going to go on the outsides of your feet and just squeeze your arches as hard as you can. What happens above the chin when you feel in the pelvic floor? Right? So if we're someone that tends to have really high arches, really tight feet, and our hips are always into this position, that creates that tension in the pelvic floor. So be able to like relax the arches, move the toes. A fun one to try really quick is, so in my shoes you can't see, but I'm lifting my big toe up and I'm pressing my other toes down, and then I'm going to switch it. big toe down, little toes up. Be able to have those flexible arches, the intrinsic muscles of our feet, these little muscles that are in between all the toes. And how that can affect the pelvic floor and up above and hips. Sorry if I gave you foot cramps. Now we're going to do the opposite. Let everything fall in, let the arches fall in. Good. What do you feel here? Do you feel added pressure? Like pelvic floor pressure? No. What do you guys feel when you drop your knees? Anyone?
Yeah, I feel pressure.
Yeah. Okay, awesome. And then, so like added pressure, increased demand on the pelvic floor, so be able to have nice flexible arches, not walking on the outsides of feet to really get tight hips, and then perpetuate those pelvic floor things. So, thank you. Yeah.
So, question.
Yeah.
So, what I think, like, aha moment here is that we, like, I would think to myself, we're trying to tighten our pelvic floor. Everything you just talked to us about is that we are tight humans to begin with. And what ultimately is going to benefit us is the fact that we got to relax. Because that's kind of like everything. Is that what I'm hearing? Is that it's when we're checking in with all these things, we're checking in to make sure that we're not tight because that's actually causing us more problems.
Mhm.
Is that what you're saying?
Yes.
That's like a big aha.
Yeah.
I would just assume that we're trying to be like tight, like you're doing a kegel so that everything's tight, but you're telling us gotta relax.
Yeah, that's foundational. So just because a muscle is tight doesn't mean it's strong. So you have to find a balance in that. So the first part of any like pain or any musculoskeletal symptom is checking in with your body. What are you doing? How are you moving day to day? What you do in a PT clinic or a gym is very focused, but then it's the outside of that you got to be aware of your posture, how you're holding things, how is that like perpetuating each other, and then building the strength. So if you have, it's a balancing act. You have to have mobility and strength, muscle awareness, coordination. So it's just learning our bodies better. Honestly, it's like the big key takeaway.
How do you strengthen the pelvic floor? Like, you're supposed to be like relaxing it.
Yeah.
Like, what do you do to strengthen it?
So glutes, hip rotators, hamstrings, adductors, quads, all the hip muscles, and then pelvic floor. So usually what I find, like 9 times out of 10, I have to first train them how to use their core and their glutes 100%. They have good coordination of their pelvic floor. They can squeeze it and they can hold it and they can let it go. But they have no activation of their glutes, or they can't load their rotators really well. And so we did a little bit of that, but it's just learning that before anything, and not going right into Kegels. And then once you have that balance, then you can incorporate Kegels into your workouts. So when you're squatting, it naturally will want to lift. When you're doing core work, making sure you're not getting that lower belly bulge and pushing, you're lifting and bracing everything in. If you're using your core, this deep core muscle, I have balloons. If you guys want to do a little bit of deep core work, I was saving it for the instructors. I'm happy to do whatever.
Yes, if I can interrupt real quick, please bring your questions up. We're going to do a private session where she was going to show some of our instructors exercises we can incorporate in classes. You're more than welcome to stay. So,
We want to invite you to stay. We want
Yeah.
to stay, and she's going to, we'll let you learn
what we're learning so
at the
you
same
can see.
time instead of rushing in.
Cool, love it. Yeah.
So I have a question on that. So
Yeah.
how do you teach somebody to engage the glutes?
Slower movements.
It's
Slower
slow.
movements, yeah. And
That
yeah, slower movements and something as simple as tapping the butt. Tactile cues are huge for muscles and what muscles you want to work. So don't be afraid to give yourself a little pat on the butt, like I'm doing a good job. Here we go. But yeah, tactile cues, visual cues, seeing yourself in a mirror, but just reaching back and touching is a
Touching.
huge.
So of the glute muscles, Which is your most powerful in the glute? Is it the maximus or the minimus?
Max.
The maximus.
Yep. You want a powerhouse behind you. You want to train all the glutes, right? But the max is definitely the powerhouse, and usually that is the most like atrophy.
It is.
Mm-hmm. Yeah.
I don't know if anyone else has heard of this, but have you ever heard of like one of the cultures, jade egg?
Yes, I have. Thoughts? My thoughts on this. So yoni eggs or Kegel weights or anything like that. It's basically this device that you insert and then you try to hold in. So there is a time and a place for it, but you want to have a really good foundation with glutes and core and hip before. It's not going to necessarily make anything worse if that's the only thing you're doing, but it's not going to help, if that makes sense, because you got to have that balance through the pelvis.
In the 90 and 20s class, people will tell us, like, pretend you have a grain of rice in your urethra, a marble in your vagina, and a blueberry in your
I love
and
that.
you're trying not to smash the blueberry. And, like, when she cues that, like, you can really
I love it.
do all the things she wants you to do.
I love it. Yes. That's perfect. I love it. Yeah, that's awesome. I love it.
Is there truth behind that? I mean,
Yeah,
there is.
yeah.
Okay.
No, it's when they've studied like cues for pelvic floor stuff, usually the most simple works the best for like all communities and all ages and female and male. So it's like stop your pee. Like that's that cue. But yes, you want to have that like first layers, deeper layer, and holding all of those together. So that cues more isolation to each group, which is awesome. Yeah.
Sorry,
No.
why does all those things make you
Because we're talking about it. Because we're talking about it. You're thinking about it. Then we're like tuning into our pelvises and pelvic floors. Like, what am I doing? What's happening? I'm like, I'm Kegeling a little bit. Did you Kegel a little bit when someone talked? Did you do
No,
it?
I need a diet.
Okay. Yeah.
I have to wake up and
Frequently, like more than twice. More than twice. So sometimes I don't want to get like too deep dive into things, but sometimes that's a lymphatic thing. So we're finally settled in and things can start pumping. Sometimes it's how much water. Sometimes it's medications or supplements that if we're taking at night. Sometimes it can be a sign of constipation. So first thing, you just want to like settle in at night. Take an hour where your feet are elevated, and then emptying before you go to bed. But it's just kind of a sign of pelvic floor dysfunction. It depends on a lot of other things: comorbidities, medications, supplements, hydration, and such. So we have to be a little deep dive. When it comes to peeing at night and urgency, frequency, those are probably more complex than just like stress urinary incontinence or pain. Yeah.
I know I could ask you anytime, but it might apply to, but like with kids, I know my girls always laugh because they're told to like hold it at school or whatever. And you say like sometimes we get these triggers of like, oh, I'm in a store, I need to go to the bathroom. Like, is it best to like train our bodies like, no, I'm in a store, that doesn't mean I have to go to the bathroom? Or is it if you feel the urge to go, like on like I guess on an adult level and a children level, like do we want to teach them that they can hold it or teach them like when you need to go, go?
Depends on how long is in between each void. So if it's been like 30 minutes, you probably don't have a full bladder, and the urge is just there because of the situation. And you don't want to stress yourself out either. So it's like, oh my gosh, it's only been 30 minutes, and Maddie talked about this in class, and I'm not going to go to the bathroom. It's just going to make it worse. But yes, there are bladder retraining things, and maybe I could actually email Hugh like our little bladder behavior retraining starting point. So it all depends on gap in between voids. On like a normal adult bladder, we should make it at least 2 hours or between voids, and it should be like a good 8 to 12 ounces, and it should be a nice good even stream. So if it's going like fire hose, if it's just trickling and it's taking a really long time, if we just peed and then we're back into the bathroom because we're at home and we can and the toilet's there, or we just got to the store and it was a 20-minute drive or 30-minute drive. We do want to start breaking up those habits and connections. And there's just little things you can do. One is rocking up on your toes and doing heel raises. That's kind of a fun one to do in the store because nobody knows what you're doing. They can't tell. It's better than it's better than this one. So yeah, going up and down on your toes. You can distract your brain by doing something tricky in your head, or phone call a friend. Distract my brain for a minute, talk to me. I have also had people pressure on the perineum, so we don't all want to do this when we're in public. So dropping down and pretending like we're tying our shoe with a little pressure from the heel. And then finding a seat, and you can just kind of like put your hands in between your knees and squeeze your inner thighs, and nobody knows what you're doing. But I'm sitting on a chair. Oh, I did something. Oh, there we go. So there's like a quick couple that you can try, but do not stress yourself out. If it's creating stress, it's only going to get worse. Go pee, but maybe seek some help.
I have a question I'm asking for a friend. Now, it's not about urine, but what about like air when you're in yoga class, like inverted, like sweeping?
Yep, I think we've all like figured this out. So that
I knew she was gonna ask that.
So that can be a result of pelvic floor tension, and we're not getting that good closure. And then you also want to like, how often is this happening? Is this happening every time I try to like sit up? Because there can be other complications that create air in that area. So this is like occasionally, and it's only with like a lot of inversion type postures. You want to work on pelvic mobility, hip mobility, and then the surrounding muscular strength, and that will get better. So give me an example of an inversion type posture.
Like if I do the adult
That's a lot. It's a lot of pressure. Yeah, it's a lot of pressure on the pelvic floor. So you can get, for like a quick fix, you can get support shorts. You can get support shorts that give a little extra oomph to that area. But long term, it's just about practicing those big jumps and compressive stuff while having the core and pelvic floor be engaged. There's a return to sport assessment that does all the jumping, and once you can do all that without leaking or symptoms, then you have a better chance of doing this high impact stuff. But I would look into the support shorts that give up your space a little bit more oomph. And then when you are transitioning out of those postures or into them, think about an exhale and drawing the ribs down, pelvic floor in, and abs in, and getting that kind of nice good closure, which we're going to do with the balloon. So, any other questions?
I have one more.
Yeah.
What if you have the opposite where you can't pee?
Yep.
Like, I can go for a run, I can do a marathon and not go to the bathroom the entire time.
Yeah, that's okay.
That's fine.
Yeah. It's only an issue, yeah. It's an issue if you have an urge and you can't empty.
No, I don't even think about it.
Okay.
But going 10 hours in a race is not normal to not be
I mean, as long as you can sit down and pee it all out, and this is not a daily thing.
Yeah, it's not a daily thing.
Yeah, that's that you've got some endurance long haulers. Yeah. So as long as it's not an issue outside of that. Yeah, no, as long as it's not like habitual, and
Okay.
when you sit down to pee, it's like, this is not coming out. I cannot get my pee out. That's what.
Well, okay, so like every morning I do, like I urinate and then I have to do one lap around and then I have to finish. Like it's almost like I can't
quite get the rest.
Get it all out at one time.
Yeah, and that's okay. Like it's okay to get up and stretch and move, especially if you know there's some more in there. That's actually very healthy instead of like pushing it out, right? So that's okay. But I would recommend checking in with like your pelvic floor and where it's at. Yeah. Cool. Thanks, guys. This is fun. Any other questions?
I have a question for you, Matt.
Yeah.
So, can you talk about caffeine, the importance of caffeine? It's a stimulant. But what can caffeine, too much caffeine, do to the bladder?
Yeah. So there's bladder irritants. And caffeine is a big one. Alcohol, sugar, chocolate. Sometimes like citrusy fruits and things, they can all make your bladder a little bit more spastic. So I take those as kind of like quality of life. I love my morning coffee, and I know I'm gonna pee every 30 minutes for the first few hours of the day, and I'm like, that's okay. I'm okay with that because I need my coffee in the morning. But if it's getting to the point where you have the urgency and you can't control it, and it's getting limiting, and it's kind of disrupting your life, and yeah, cutting out more bladder irritant type things can help reduce urgency because it does create muscle spasms. The bladder is a muscle, and it will spasm and create that, oh, I gotta pee all of a sudden, but I just peed 5 minutes ago. It was from that caffeine.
Any other questions? All right.
I'm really sweating a little bit.
The right place. That's what we do.
Do you want to transition maybe
Yeah.
into some of the exercises
Yeah.
from that?
Yeah, let's do it.
So if anyone needs to leave, they can leave.
Yes,
now.
if you want to
Yeah.
stick around for some exercises, be our guest.
Thank you.
You don't have to do one.
Yeah, she didn't show. She was a map.